Hi, everybody. My name is Stephanie Prim, and I am the director of Living Our Visions Inclusively. And we are a nonprofit based in Madison, in Wisconsin. And we work with adults with developmental disabilities. And today I have a special guest. We are practicing social distancing, so I'm going to drop her down from the sky. She's coming down on a ribbon. Everybody, this is Marcia Stickel. And she's also with us on the phone. Marcia is a nurse with many decades of experience working with adults with developmental disabilities, and she is an expert at giving really good, concrete, practical advice. And I have many times requested Marcia's expertise in helping us think about how to give information to people we support. So also on the phone is Alyssa Hermanson, the assistant director of Love Inc. And she's going to be fielding any questions that come in on the comments. So just to give everybody an overview of what we're going to do, Marcia and I are going to talk through a set of questions that are general about what's happening right now. And we'll go through a lot of tips and advice. And then after we do that, we'll open it up to questions. We're not going to go for longer than an hour. So, but we might have some follow-up live events so that more people can access this information. So, Marcia, do you want to say hi to everybody?
Hello, everybody.
Great. So, Marcia, let's get started. What's happening? What's COVID-19? What should people know about this illness?
Well, it's a new one. First was identified in December in China, but it's now spread all over the world, including in every state of the United States and in our county. It's a virus that seems to be very contagious, especially when you don't even realize you have it in the incubation period. And so for that reason, it's easily transmitted. Most people survive very well. Some young people aren't even aware that they are having a problem, and then that means they are spreading it to others. But for people in the risk groups, it can be very serious, and some people have died, and there have been times in some places, especially Italy right now, where the hospitals can't keep up with the serious patients and meeting their needs.
Okay. And the word pandemic keeps getting used when people are talking about COVID-19. Can you explain what that word means?
Yes. So it sounds very scary. It really only means that it's a disease, in this case a virus, COVID-19, that has spread all over the world. That's what pandemic means. It's spread everywhere.
Okay. And so for people who are watching, who are just wondering what they should be doing right now to keep themselves safe or prepare for potentially getting sick, what advice do you have?
Yeah, there's a lot of things, and I think that's really what we should emphasize. There are many things you can do to help yourself. First of all, be prepared. Try to have 2 weeks worth of supplies of food and other essentials, including the toilet paper that seemed to have been such an issue, and your prescription meds. So having a 2-week supply is important, because if you are exposed, if you know you've been exposed, you're going to want to stay put. And we'll get into that about quarantine later in this program. But you need to have 2 weeks worth of things in your home so that you can stay put for that amount of time. Then as far as staying safe, social distancing is what you've been hearing about. And even not in quarantine, but rather in staying at a distance from people. So many places have been closed, which I'm sure aware of, and so you're not going to be able to be in large groups because that's not allowed now.
Mm-hmm.
But even if you are with someone who's from your family or a friend, you want to have social distancing, which means you put your arm out to your side, the other person puts his or her arm out to the side. That's about 6 feet between the two of you. That's the distance you want to keep from other people.
Okay, so if you stick your
arm
straight out from your shoulder, and they do the same thing.
Straight out from your shoulder. Mm-hmm.
Okay.
The other person does the same thing. So that is about 6 feet. That's an easy way to keep track and to understand what they're recommending.
Okay.
A 6-foot distance between people.
Okay.
And avoiding groups of people.
Mm-hmm.
A key thing is washing your hands. It's just super important to wash your hands. You may have heard many times, wash your hands before you eat, wash your hands after you go to the bathroom, and those are still very important.
Right.
But it's also important to wash your hands if you have been out in the community, if you've been to the grocery store or somewhere else, or if you've handled something that somebody else has handled, such as a bag. Maybe somebody brings you a bag of something and you don't know how many people have touched that bag. It's a really good idea to wash your hands again after you've put things away. And we want to make sure you're washing your hands as long as you need to and as thoroughly as you should. Most of you know the Happy Birthday song, and I just made a little bit of adaptation to that. But I'd like you to sing this when you wash your hands with soap and water to make sure you're doing it long enough. Here we go.
Let's go.
Happy wellness to you. Happy wellness to you. Happy wellness, dear clean hands. Happy wellness to you. If you sing that song and wash your hands during that whole time, you will have washed your hands long enough. And that's something that all of us need to be doing.
Mm-hmm.
Don't forget your thumbs. We sometimes forget to wash our thumbs. So you want to wash all your fingers and your thumb and in between and front and back, all while you're singing the song. And then you can be safe and know that you've got your hands good and clean.
Is there anything else that people should do that will help keep them safe?
Yes. Avoid touching your face as much as possible. It is so easy. We all do frequently touch our faces. Don't pick your nose. Don't bite your fingernails. Don't put your hands in your mouth. Lots of don'ts.
Mm-hmm.
Just try not to rub your eyes. Those are all things we often do, is touch our face. So as much as possible, try really hard not to touch your face, and especially not to put your fingers in your mouth, because those all put you in more risk of getting COVID-19.
Okay.
The other thing you can do is to clean surfaces that you touch a lot. Doorknobs, especially faucet handles, phones, computers. You want to clean them on a regular basis and try to eliminate any virus that might be put on there, especially if it's people you don't know are safe, and it's kind of tricky to know who's safe, because you could be sharing COVID-19 when you aren't even aware that you have it. So it is a really good idea to do the wipe down. There are disinfectant wipes that I know can be kind of hard to get, but there are other things that can also be used. And are we going to is that going to go up on the screen later? Basically, it's bleach with water, or rubbing alcohol, or hydrogen peroxide. Any of those three can be used to disinfect as well.
Okay, so there's other things that people can use. Now, you said a minute ago, Marcia, that people can be sharing the virus COVID-19 when they don't know that they're sick? How does that work?
Well, it seems so far everywhere that people have had it, that younger people are not as likely to have severe symptoms. Mm-hmm. They might not get nearly as sick, or they could. You can have been exposed and actually have the virus within you, and for 2 to 14 days before you get sick. So there's two possibilities. One, you might not ever get the symptoms and be really sick, mm-hmm. but still share it with others, mm-hmm. or you may have it and will eventually get sick, but you haven't gotten sick yet. So in either case, you could be sharing with others, which is another reason for the social distancing. But there's also some things you can do to kind of be aware of whether you might get sick. Mm-hmm. I really would encourage, if you have a thermometer, to just take it a couple of times just to see what your temperature is as a baseline, mm-hmm. a normal temperature. Mm-hmm. And so then, if you start to feel a little off, you can check your temperature to see if it goes up. Okay. That is one of the signs.
So everybody isn't all 98.8 all the time? That's not normal temperature?
No, it certainly isn't. Some people's normal is around 97. And an interesting factoid that doesn't have anything to do with COVID-19, your temperature is usually lowest early in the morning and highest in the evening. Just normal. There's some changes. Okay. So that doesn't mean we should get all freaked out if our temperature changes a little bit. But if your normal temperature is 98, say that's your normal temp, and then you now have a temp same time of day and it's 100, mm-hmm. that can give you an indication that something might be developing as far as the COVID-19 could be an issue for you.
Okay. So if you're checking your temperature to find out what it normally is, if you do that at the mm-hmm. same time of day each day,
yep, that would be good. Yes.
Something that's, I think, confusing for some people with disabilities is changes in routine, right? And right now, everything's getting canceled. Places are closed that they like to go to. They maybe can't go to work because their workplace is closed. Do you want to talk a little bit about how that's related to COVID-19?
I sure do. That's really important. And I know it's such a hassle and kind of scary, too, because it's different. Actually, there hasn't been something like this for over 100 years. But it is important that all of these places are closed, and it is important that you keep from going to places where there's large groups of people, mm-hmm. because that's how this virus gets spread. Mm-hmm. The big worry is that too many people who have high risk can get sick all at once, and then there'll be a problem because there won't be enough room in the hospital for them to get the care they need. So it's hard, and I know it's frustrating, but it's extremely important, not only for you, but for others. Mm-hmm. It's really good to work together with whomever is important in your life to set up a new schedule, it's just a new way of getting through life because you're not able to get out and do things like you usually do.
Mm-hmm. Yeah. So creating some routine or something
mm-hmm.
to keep your mind active while you're spending.
And we might as well get a new routine because this isn't going to go away quickly. This is going to be a while. I would expect the earliest be May before really things will change much, and it might be June. Okay. So we might as well get used to it and find a routine that works for us because it's going to be a while.
Okay. So there's going to be enough time where we're all going to be doing this social distancing for people to kind of establish a new routine.
That's right.
Different routine. Okay. Something that I've been hearing a lot about on the news, and I think other people have too, is this term quarantine. Will you talk a little bit about how that relates to COVID-19?
Right, and that is quarantine is something from history where we hardly have heard about that in our time, but it means staying put. Staying put completely in your home, or if you live in a home with more than one person, it means staying in your room. It's really serious because at this point, this is for somebody who has COVID-19.
Okay.
And when you know you have it, you must be responsible not to share it.
Mm-hmm.
And we want to make sure that quarantine is followed because, again, that keeps other people safe. Some people who have had a direct, significant exposure to someone who's sick with COVID-19 may also quarantine. Some people in the news who, like people who were lawyers and congressmen and even basketball players who've been exposed, they're quarantining themselves for 14 days just to make sure, because it can be up to 14 days before you know if you've got it. Okay. So we want to follow that plan.
Mm-hmm. Okay. So let's get into what happens if somebody thinks they are getting sick and it might be COVID-19. What should they do if they think they're sick?
Right. So there's going to still be, I just want to put this out there, there are still going to be colds and there's still going to be allergies, especially as we get into spring. So there's going to be some things that may make you feel kind of sick, and it won't be COVID-19. So what you want to do is the take your temperature. That's a really important thing we talked about already. And if you have a cough, especially most typically a dry cough, and the other thing is if you feel like you're short of breath. So if a person isn't able to verbalize or explain if they're short of breath, and especially if they have any risks like asthma or other kind of breathing problems in their history, if you can get one, a pulse oximeter, that little clip that looks like a clothes clip, but it fits on your finger, called pulse oximeter. Again, that can show what your normal oxygen level is, and then if it drops, that would be another thing that you would want to share. You would call your doctor's office. You don't call 911. It's not an emergency. But if you think you have COVID-19 because of your symptoms, remember, temperature has gone up, so you've got a little fever, you've got a cough, and you're having some shortness of breath, you're having to work harder to breathe, then you call your doctor's office.
Okay.
And it's not going to the hospital. And then they can talk with you about your symptoms. And if they think you need to be tested, they will tell you specific arrangements for you to be tested. And some of those things are changing as we go along. Right now, it means going into the doctor's office through a special door into a special place where you will be getting tested so that you don't come in contact with other people.
Okay. So you don't.
But again, I want to emphasize, you don't, just because you think you might be getting sick, you don't call 911.
Okay. And then when somebody is tests positive for COVID-19, what can they expect to have happen during their illness, or what might change for them?
Yeah, so quarantine, which we'd already talked about, means you stay put. If you can, you stay in your room. If you are sharing the house with others, with the door shut. If you can, you use a bathroom separate from others. If you are in the same room as someone else, you should, in this case, Wear just a regular face mask.
Okay.
A face mask doesn't protect you from getting COVID-19,
Mm-hmm.
but a face mask can help with any droplets, like if you should cough or sneeze unexpectedly, the face mask can catch that and prevent it from being moved through the air and go onto surfaces. If you're in the room and nobody else is around and you start to cough or sneeze, either use your elbow or a tissue and then get that tissue in the trash right away.
So,
And wash your hands. Here we go again. Wash your hands. I'm not going to sing for you again, but go ahead and sing your song. Washing your hands is going to be even more important if you have COVID-19.
mm-hmm.
And then you want to stay put.
Okay.
Most likely, from the time you have the virus
Mm-hmm.
and know you have it, you will stay put. You will be quarantined for 2 weeks.
Mm-hmm.
That's 14 days. But you will be in contact with the doctor as far as when you can leave. Some older people and people with higher risks get more sick, and it lasts up to 6 weeks before they're free to leave.
Okay. Okay.
There's no medications that will cure it, and basically what you do is treat the symptoms, what makes you feel bad. If your fever is high, if you're achy, you may take, but what's recommended is Tylenol, or acetaminophen is another word for it.
Okay.
If you have just a low-grade fever and it's not bothering you too much, you don't have to take anything for it. The fever can help a little bit in fighting the virus, but you want to keep yourself comfortable, and like with anything else, you want to be sure that you're drinking enough fluids, and you will, of course, want to still eat. Most people don't have any problems with their stomach, and they are not troubled by either nausea, vomiting, or diarrhea. There's been a few people who've reported it. So that part of you should still be working fine.
Okay.
If the shortness of breath gets really severe,
Mm-hmm.
if the symptoms get really, if your fever gets really high, then somebody is going to need to get you in. Only in those cases should somebody be going into the emergency room, because the hospitals are going to be very full,
Mm-hmm.
and they will not be happy if you come in and you're not really very sick.
Mm-hmm.
They really want to encourage people to stay home and deal with it in the ways we've described.
Okay. Okay. And then for people who might share a household with someone who gets COVID-19, what advice or what's the best advice you have for them to keep themselves safe?
Yeah, it's going to be tricky. I mean, keep your distance, clean surfaces way more frequently than we already had mentioned.
Mm-hmm.
If somebody else is needing to do the laundry for that person,
Mm-hmm.
I mean, as much as possible, the person is in their own room and they're able to do their own cares. Having a laundry basket that's got a bag in it, lining it, so they can put their dirty things in there, and then the person who's going to do the laundry, for instance, can take that bag. This is a case where it would be good for the person who's sharing the household to wear gloves when they're handling those things.
Okay.
And so as much as possible, you're trying to avoid contact with the things that person has touched.
Mm-hmm.
You're going to want to use the gloves, but then you've got to remember, gloves need to be thrown out.
Mm-hmm.
You don't want to be touching your face with dirty gloves.
Mm-hmm.
And if you don't have disposable gloves and you have reusable gloves, then you've got to wash those gloves, just like you'd be washing your hands.
Okay.
Before you take them off. So you use soap and water on the gloves before you take them off. The face masks should be always used by the person who's sick.
Okay.
The person who's the caregiver, the face mask gives you sometimes a false sense of security, and it really isn't protecting you because they are not designed to protect you from all of the droplets. The only thing it could possibly do if you wore a face mask as the caregiver is to keep you from touching your nose and mouth because it's covering your nose and mouth. But other than that, I really, it's a false sense of security sometimes for people to wear a face mask when to think they can not get the virus because they still can.
Sure. Now, not everybody is going to understand having a face mask put on. So if someone who you can't really explain to them what COVID-19 is needs to wear a face mask, could other things like a softer bandana or something like that, even if it doesn't provide the same level of protection that a face mask does, what would you recommend?
Yes, that is a good idea, and you're right. I certainly have worked with many people who can't tolerate things very much on their face. Whatever, if there's anything soft that they would tolerate to cover their nose and mouth, that can be used. When things are being washed from somebody who has COVID-19, you want to use the hottest water possible. So say somebody will tolerate a bandana around their nose and mouth, then that, of course, needs to be washed in hot water, and if you can put bleach in there, I mean, if it discolors the bandana, we don't really care at this point. So bleach in hot water when you wash fabrics that are known to have COVID-19.
Okay. So we talked before we were live about the best, if you can give 3 pieces of advice to people with disabilities about what's important right now. So we talked about hand washing, we talked about the social distancing, and also being aware of the symptoms. So for those of you out there who are caregivers or supporters or family members of people with disabilities, those are kind of the 3 things to work on doing some education on right now, before people are getting sick, right, in order to prevent them from getting sick or from sharing the germs and the virus with other people. Do you want to say more about any of those, Marcia, or should we review them?
I think we've discussed them, and I think it's just good to think of those 3 and realize those are things that can be done. There are things you can do, and it's good to know that you can do them. And they seem simple, but they can have a major impact. The other, I just want to make one plug for exercise. Anybody who's known me in the past knows that I'm a big proponent of exercise. But even just as far as a new routine, if the weather permits, I strongly encourage each individual to get a break outside, to go outside, to walk around, to jump, to do things outdoors, because that also can be very healthy for a person. If an individual has a caregiver, you can be very strongly encouraging the caregiver that that's a necessary part of the daily schedule. If a person is in a wheelchair, they should still be able to get out and be wheeled around the block and have some fresh air. And that can kind of help as far as the routine. It's something beyond the 4 walls. One other thing I would say is typically we don't want our loved ones to be too focused on screen time, and we want them to do other things. And in this case, screen time may just be a given. If that will help people to be content to be isolated from the typical activities where they would be in a group, screen time should be allowed. And at some point in time, we're going to get back to normal and being able to be out and about, and then there may need to be a weaning back from screen time. But right now, it is a way to keep people safe.
Yeah. No, I think that's really important. We talked about I think you use the term, how do you keep people motivated to stay at home?
Mm-hmm.
And I think those are some really good ideas. Now, you said you had found a couple of interesting videos or YouTube channels that people could check out. Do you want to list those for everybody?
Well, there are several that have live Facebook things each day.
Mm-hmm.
I know the zoo here in Madison has one. I'm not sure if theirs is daily. The Cincinnati Zoo
Mm-hmm.
has a daily one with a different animal each day, and it's probably about maybe 15 minutes. You see the animal interacting with the caregiver, and it is unique. The first day was hippopotamus.
Nice.
Was fascinating. So there's probably others. I'm guessing there's other zoos that do. Yes, the San Diego Zoo is doing it too.
Oh, okay, great.
So it'd be well worth checking out some of those possibilities. There's also a number of museums that are doing virtual tours. So if that's something that would interest somebody, they can look up virtual tours, museums.
Okay.
There's been several different art things that have gone live and are probably still on YouTube now, taped. So you can do projects with stuff from your recycle, and other kinds of projects where you might need to have more art supplies, or at least crayons and glue, maybe. I don't know. I mean, I haven't sat and watched them. I've just seen them be mentioned.
Mm-hmm.
I'm on Facebook with a number of families, and so as they mention those and how that's helped with their kids, I'm thinking, this could be something for somebody with developmental disability to do as well, and help break the monotony.
Yeah, sure. And you mentioned too, Marcia, just even creating some sort of daily schedule or daily routine, which as a newly retired person, you had to do that recently, I bet.
That is exactly right. And it's funny. I don't know. Yeah, I suppose you could say it's funny. It's like, I've got the whole day ahead of me, and the time kind of drifts along, and then, I need to have a routine, and it's better. It's better for all of us to have a routine.
Yeah.
I think we feel better having a routine.
Yeah.
So I really think that's very true for individuals with developmental disabilities. But it is also true for all of us. Mm-hmm. And so that can be a strength for somebody, because then they know what to expect.
Mm-hmm. Okay. A couple more things that we didn't touch on yet. So we've heard a little bit in the news about, there are certain risk factors that may make you more likely, if you do get COVID-19, to get more sick or very sick. Do you want to talk a little bit about what those risk factors are that people should be aware of? Different conditions?
Oh, yes.
Yeah.
That is important. I don't want anybody to be overly scared, but they should be aware. If you have a respiratory issue such as asthma or COPD, it's a chronic intermittent bronchitis. Those are all kinds of breathing issues, or you've had a history in the past of breathing issues, that puts you at higher risk. If you have diabetes, either type 1 or type 2, that's considered a high risk. These are from the CDC, and cdc.gov is a great resource for information. Don't get confused by there's some kind of crackpot, I call them, things that are out there that are not true. But CDC is a safe source. They also list heart disease, especially congestive heart failure, as a high risk. Okay. And anybody who's over 65 or older is considered high risk. I looked at another site, and they mentioned things like multiple sclerosis and cerebral palsy. Certainly cystic fibrosis would be another one. definitely, I know that from my work with people with cystic fibrosis, they have breathing issues. Anybody who's having treatment for cancer, they would be at risk.
Okay.
People with other autoimmune diseases could also be at risk. So if you wonder if you are at risk or the person you're caring for is at risk, extra risk, you should check with the doctor's office, the primary care physician, and just say, is Joe more at risk because he has such and such, and they should be able to give you a clear answer.
Okay. So the other thing, in addition to, health conditions that might put you at higher risk for getting very sick if you do get COVID-19, there's also some behaviors that can put you at more risk for catching it from people around you. So for example, everybody who's ever spent even 20 minutes with me has probably seen me blow my nose. I blow my nose 150 times a day. Because that's just how my nose works. But I also, this past week plus, have had to work really hard to train myself not to touch my face. I would love if anybody in the comments has noticed me touching my face. I've been holding a pen under my desk here to keep my hands from my face because I don't want to set a bad example. But a lot of people with disabilities, it can be harder to explain why they need to stop doing things the way they've always done them, in particular with their personal habits. So what are some examples of those risky behaviors that people might exhibit?
Right. One of the typical ones is putting their fingers in their mouth and then taking them out. Of course, their fingers, they may wipe them on multiple surfaces, and then they can easily pick up things from surfaces and then put that directly in their mouth, which puts them more at risk for the virus.
Right.
And then on the other side, if they have the virus, they certainly are spreading it.
Okay. Yeah. So, and even those of us who have office jobs, right, and there's, a communal pile of pens somewhere, if you have a habit of putting the end of the pen in your mouth while you're thinking.
Oh, there you go. That's another one. Yep. So. Biting your fingernails is another one. Sometimes people are they just like to touch others a lot.
Sure.
And in this situation, that's not social distancing. That's not keeping that 6 feet, that arm's length. And so that puts a person more at risk if they are a toucher. And that might be very difficult for that person to adapt or understand. So then we have to realize that, that does put them more at risk. And it's just going to be a tricky thing to try to change that.
Rubbing your eyes, picking your nose, all of that as well.
Right? Oh, yeah.
Yeah.
Those are all habits and behaviors that we want to eliminate as much as possible. And it is hard. I have dry eyes myself, and I also have allergies. So when my eyes are itching, it's really, really hard not to rub them. And I understand that. But it also is really important to try not to. So when we've worked on habit change with individuals at other times, we've tried to give them something else to have in their hand that they could fiddle with, and that could help. Having, what did they call those things that were such a big deal last year?
Oh, the fidget spinners.
Fidget spinners. But then, there's other things. Some people really like the silky, smooth feel on the edge of a blanket, and would like to rub that between their fingers. So if that's something that would work to help diminish, we're all about being practical, right? And so if we can find something that will help to diminish the behavior, even if it's not 100% successful, it's still worth trying. Other people, like a smooth stone, if they won't be putting it in their mouth, but a smooth stone to rub between the fingers. There's worry stones.
And those are all things you can sanitize pretty easily as well if you need to wash them regularly and wipe them off with a disinfecting wipe or a bleach solution.
So exactly. The people who know an individual, as I've said many times when I've taught classes, have the power to help implement change because they know the person and what the person likes. What does the person like to feel or touch? What does the person tolerate or enjoy? And so, I really encourage, there are things that can be done. It takes creativity, it takes common sense, it takes looking at the practical, but it can really make a difference.
Okay. Well, I want to pause here and invite any of our viewers who want to type a question into the comment box. We'll try and answer some of those. But Marcia, you had a couple of just really practical tips that maybe are things people haven't yet thought about. So things like changing pharmacies so you can either do delivery.
Oh, right. Yes. So when you think about your interactions with people socially, what we're trying to do here is to limit them. And so one that I mentioned was if you are in the habit of going into a pharmacy, such as Walgreens, to get medications, there's always lines and interactions with multiple people. If instead you make it a point to use the drive-up, you're greatly reducing your social interaction. So you're doing more social distancing, which is what we're recommending. Likewise, if with groceries, if you can, instead of going into the grocery store, if you can order them online and then go there for the pickup, or some people are having groceries delivered. Again, you're eliminating that contact with other people.
Yeah. Okay. It looks like we do have a question from a viewer. So folks who use chewy objects, so to self-soothe,
yes.
How frequently should they be changing them out or disinfecting those? What tips do you have regarding those type of devices at this time?
Again, it somewhat depends on the circumstances. So if a person is at home and they're not in contact, so if they're in social isolation pretty much, and they're not in contact with others, then they should be cleaned probably just a little more than they previously have been. And they need to, as always, they need to be scrubbed well and rinsed well and dried. Air dried is the best if you can, so you do need to have enough chewies that can be done. If they're out in the community, then as soon as the person comes home from wherever they've been in contact with other people, that one should be washed, and they should have a clean one from at home. If they're in a group setting, I don't know if they're having the day centers are open. I don't know. Then I would encourage switching them out. So sometimes there's a snack time, and then there's a lunch, and then there's an afternoon time. I guess probably, if possible, I think they should be cleaned at each of those times. So like every few hours, where they are, and then if they have COVID-19, then they are, and if they're kind of isolated in their room, if that's possible, they still need to be cleaned, but they need to be cleaned with, of course, the utmost of care. Caregiver needs to be wearing gloves to clean them. So again, I'd say probably switch them out a couple of times a day because if the person is separate from others.
Okay. Okay. That's helpful. Another question, you had mentioned some cleaning supplies that could be used in lieu of having access to disinfecting wipes because the supplies are so low. So somebody asked if hydrogen peroxide needed to be diluted when used as a cleaning agent.
It does not.
Okay.
It should be undiluted. Yes.
Okay.
So here's the thing. For the bleach, it's 5 tablespoons or 1/3 cup
Okay.
of bleach to a gallon of water,
Okay.
or 4 teaspoons of bleach to a quart of water.
Okay.
So that you definitely want to, you want to have it mixed with water in that amount.
Uh-huh.
1/3 cup to a gallon, or 4 teaspoons to a quart. But for the rubbing alcohol or the hydrogen peroxide, neither one do you dilute. You use it straight, and be aware that if you do use hydrogen peroxide, it's great. It's recommended putting it into a spray bottle, and you can get it into even cracks and things if you need to. But it has to sit for at least a minute, and it doesn't need to be wiped off.
Okay.
But it will discolor fabrics.
Okay.
So
Same with
the bleach water is bad for metal, so you have to be careful. If you spray it on metal, you're going to need to get that off of there. But hydrogen peroxide will not affect metal at all, and I'm not sure about the alcohol actually. But both the alcohol and the hydrogen peroxide, you need to just let it sit.
Okay.
And dry.
Okay.
And yes, so those are alternatives. I know it's really hard to find the wipes, the disinfectant wipes right now because I wanted some for my car and I couldn't find any.
Right. Yeah. No luck there. Another question. So for folks who are still interacting out in the community, whether they're having to go to work still or transportation, they're on vehicles with other people or going to a day program, are there steps they should take when they get home to clean themselves off? Should people be changing into fresh clothing, that kind of stuff? What's your recommendation there?
I may be too cautious, but I just feel like, especially in the world of disability, it's really easy for people to get whatever somebody has coughed or had their mouth open and their fingers and they rubbed on things. It's just really easy to get some of that on you, whether for sure on transportation, but even in the community, because just people are kind of prone that way. So if that is the case, I would encourage when they get home that they do remove their clothing, put it in, a lined hamper basket, and wash their face and hands at least, because those would have also been exposed, with soap and water. And if that's the time of day to do a shower, that might make sense. If they have a shower one time a day, it might make sense that the shower be done when they come home from their time in a group. That's not typical. That's not what people usually do, but it would just be a way of being extra cautious.
Okay. And so if they're showering, making sure that they're washing their body with soap.
Oh, yes.
The
shower. Big deal really is, and soap, yes. Soap and water is most important. Even when, that's something we didn't mention that should be mentioned.
Yeah.
When you're wiping down surfaces, you need to wash them first if there's any soiling of it, because the disinfectant alone will not do its job if there's any kind of material, anything that's been spilled or anything. That needs to be removed first, so then the disinfectant can work properly on the bare surface.
Okay. So if it's a kitchen counter, and you had some food spilled
Mm-hmm.
from dinner, to wipe that off
Right.
first, and then okay, that
Yep.
makes sense because the disinfectant
Yep.
has to get underneath where that stuff is.
Mm-hmm.
Okay. Um, so just as a little bit of a review, we talked about using for folks who are nonverbal, right, and might not be able to describe their symptoms accurately,
Mm-hmm.
having a thermometer in the house and also a pulse oximeter,
Yes.
which are hard to come by these days, but even if we looked online on Amazon prior to starting the event, and you can still get them. It may take a couple of weeks to be delivered. It's not going to be the fast shipping, but to go ahead and order those things so that you will be able to monitor someone's blood oxygen level through the pulse oximeter, and then also temperature, to check that at the same time every day, so you can tell if there are variations, and if their temperature starts going up. And for a pulse oximeter, Marcia, what's the range of numbers that are relatively healthy? Do you want to give that?
Right. Sure. So, what a hospital will say 92
Mm-hmm.
to 100. Very rarely does somebody at 100%.
Okay.
And I wouldn't. What you really want to do is see what the norm is for that person.
Mm-hmm.
So, if somebody has a 92, that's okay. Then you know that they're at the lower end of normal, but it's nothing to panic about. Then if they go down to 90, you know that they've had a loss of oxygen, so they're probably struggling some. And again, it's not a 911 call, but it's an awareness there's been a change. Conversely, if somebody is usually at a 98% and then they drop down to a 92, even though that's still within the normal range, it's a big change from their baseline. So that's a warning sign that they could be having COVID-19 and shortness of breath. And again, it's not a 911 call, but it's an awareness.
Right.
That's really what we're working toward, is to have an awareness.
And potentially, in the case of somebody dropping significantly in their pulse ox, you would want to be in touch with their general practitioner, their doctor.
Oh, yeah. And, if somebody is down in the 80s, you want to make a call right away.
Right.
And so, yeah, but I think the person, now again, if somebody with COPD, I don't want to get too nursey on you. Well, let's just say we'll get the baseline, and then go from there. And for somebody who has COPD, probably would want to be in touch anyways with the specialist pulmonologist to ask about what to do and when that person should go in. But that's kind of a unique situation.
Okay, all right. Alyssa, are there any other questions coming in that we're not seeing here that we haven't answered yet? Anything we missed?
No, I would say maybe just going back to the importance of primary caregivers staying in their own home if they are at risk as very and not visiting their loved one. Maybe talking about that a little bit more.
Sure.
Oh, that was on the very same thing. We had mentioned when we kind of talked about this program earlier, that some people were concerned about should they visit their child, so a parent wondering, should I visit my adult daughter in her home, for example. And so my answer was, it really depends on the situation. So if a parent is in the high-risk category because of age or coexisting conditions like diabetes and breathing conditions, whatever, then they should protect themselves by staying as distant as possible, as much as they feel comfortable, and maybe do some sort of communication by phone and by video conferencing or whatever with their with the daughter, and with the staff if she has staff. On the other hand, if both sides of people are very well and they're not at risk, then it's okay to continue visits. If a parent is working, say, as a nurse, just for an example, at the hospital, and they're at risk for having COVID-19 because of their profession, then again, that would be a time where keeping your distance from your adult child would be recommended, because you don't want to put the risk of sharing that right in their front door.
Okay. All right. Alyssa, unless there are other questions, I just want to review kind of the top 3 things that we wanted people to remember. So the hand washing with Marcia's song that she wrote specially for us, guys. We should feel very honored. Social distancing, and if you're trying to explain how far away they should be standing, a really easy way for people to do that is if they hold out their arms straight out from their shoulder, which I'm attempting to demonstrate on a webcam, which is not easy. If they hold their arm out that far, and then the person who's in the room with them also holds their arm out that far, your fingers should not be touching. That's about that's a good way to know if you're more than 6 feet apart from somebody, without getting out a yardstick or a tape measure or anything like that. And then teaching people about the symptoms of COVID-19 to be aware of. So Marcia, do you want to run down quick what the main symptoms are that people should be paying attention to?
Certainly. So a fever, a cough, and the fever is probably the most significant one that would differentiate from other kinds of things like a cold.
Okay.
So a fever, a cough, and shortness of breath.
Okay. All right. And if you have somebody who is not able to report symptoms, using that daily thermometer check and a daily pulse oximeter check,
Yes.
so that you can be aware of what their body is saying, even if they can't tell you or explain it to you.
Correct.
Okay.
Yeah.
Any last words of advice, Marcia, before we end our call here?
Well, I just want to encourage people that these things matter. There are things you can do to help yourself and others. And we want to be aware, but we don't want to be scared.
Okay. Yeah, that's really great advice. Marcia, thank you so much for giving us your time. We may continue this series with Marcia over the coming weeks as we all have more questions, I'm sure, and more things will happen. And Love is also going to be putting together a bigger series of what we're calling virtual distractions. So in addition to bringing in experts to help us learn about things, we're also going to find some fun things that we can support people to do together from a distance while we're all trying to stay home and keep ourselves safe. So stay tuned on our Facebook page, and we'll post announcements about when those things are happening. So thanks everybody for listening, and thanks again, Marcia, for your time today.
Glad to do it.
All right, bye-bye.